Next, we're going to talk about middle range theorists. First, we have Benner's skill acquisition theory. Nurses progress through 5 stages of skill acquisition. This is important for us to know because as we progress through our nursing career, we can understand where we should be at in the different levels. The first stage of skill acquisition is novice. This is us nursing students. Beginning education with little to no clinical experience, taught general rules to help perform tasks. Rule-governed behavior is limited and inflexible. What this means is that we have a general rule for every action that we perform and we follow it to a T. The second stage is advanced beginner. This is the first 2 years of practicing. They demonstrate acceptable performance, have gained prior experience in actual situations to recognize recurring meaningful components. Principles based on experiences begin to be formulated to guide actions. This is where we develop our sense of morality and our ethical principles. Stage 3 is competent. This is 2 to 3 years experience. We are more aware of long-term goals. We gain perspective from planning our own actions based on conscious, abstract, and analytical thinking, and help to achieve greater efficiency in organization. We rely less on rules here and more on our own experience. Stage 4 is proficient. They perceive and understand situations as whole parts. More holistic understanding improves decision making. We learn from experiences what to expect in certain situations and how to modify plans. This is going to be, after 3 years of experience, the majority of your nursing career. Then we have level 5, expert. We no longer rely on principles, rules, or guidelines to connect situations to determine actions. We have much more background of experience and have intuitive grasp of clinical situations. Performance is now fluid, flexible, and highly proficient. This is where we term our vets, the women and men who have been nurses for a very long time and make the best educators because they don't teach us just on rules, they teach us about their years and years of patient and clinical experience. Next we have Kolkaba's comfort theory. Nurses facilitate health-seeking behaviors in patients by striving to relieve physical, emotional, socially, environmental, and/or spiritual distress. This basically just encompasses the fact that nurses provide comfort for all aspects of the patient, be it emotional or physical, spiritual, and this can be through referrals, not just direct patient care. Next we have Pender's health promotion theory. Nurses understand that a patient's personal characteristics, experiences, and beliefs affect his or her motivation for adopting healthy behaviors. This includes things like smoking cessation and proper diabetes management. This is more about health promotion than health prevention. So we want to promote healthy behaviors and understand the patient's current behaviors and how we can help them to adjust those to meet the health standards to keep them at a well-functioning level. Next we have the American Association of Critical Care Nurses Synergy Theory. Matching nurse competencies to patient needs in the critical care environment improves patient outcomes. This basically encompasses the theory that well-educated and well-rounded nurses are imperative to meeting the needs of patients in the critical care environment. So if you're treating a patient with a traumatic brain injury, you should have the proper knowledge to know what to look for and how to treat this patient. Next we have Michel's uncertainty and illness theory. Nurses facilitate patient coping and adaptation by performing interventions aimed at helping patients process and find meaning related to their illness. A lot of patients are very unaware of what's really going on inside their body and how their lives are going to change when they become ill, such as a new diabetic. So we need to help them cope with the new adjustment in their lifestyle, such as diet and new insulin injections and daily finger sticks. These are very hard for a person to adjust to. We also need to perform interventions, such as education and counseling, before we allow them to go home and adjust on their own. Next we have Eakes, Burke, and Hainsworth's theory of chronic sorrow. Nurses understand that the disparity between desired and actual reality often leads to continuous cycles of grief. For example, chronic sorrow sometimes occurs in parents of children with chronic disabilities or in individuals diagnosed with a chronic illness. Adjusting to being sick is not easy. Chronic pain can lead to depression, and chronic illness can lead to confusion, anxiety, and again, depression. It's very important that we help our patients to adjust to this new lifestyle of being sick and try to find a way for them to maintain as much functionality and independence as possible. Next, we have Peplau's interpersonal theory. Hildegard Peplau is considered the mother of psychiatric nursing. Nurses help patients reduce anxiety by converting it into constructive actions. They develop therapeutic relationships with patients that are respectful, empathetic, and non-judgmental. The following phases characterize the nurse-patient relationship. The nurse serves as a resource person, a counselor, and a surrogate. Next, we have Leininger's culture care theory. This one is very important. Human caring varies among cultures in its expressions, processes, and patterns. Social structure factors such as the patient's politics, culture, and tradition are significant forces affecting care and influencing the patient's health and illness patterns. Think about the diversity of patients and their nursing care needs. Provide patients with culturally specific nursing care. This is very important because certain cultures don't allow certain things, and we have to be very considerate, such as Jehovah's Witness not allowing blood products to be used, or Asian cultures not making eye contact, things like that. We don't want to offend anybody or create a hostile environment that could impair their care. So I just wanted to touch a little bit on why we need to learn these theories. They're vital to understanding why we do what we do, as they're based on evidence and thorough research, giving us a strong foundation as well-rounded and educated nurses. Everything that we do is evidence-based, and we need research to create this evidence so that we know why we're doing what we're doing and the results that we should be able to expect. I know it might seem repetitive and it might seem like it's not necessary, but in order for us to understand why we're doing the things we're doing, it's important to understand where all of these theories come from.